Do a rectovaginal exam using a pill rolling motion to assess the integrity of the anal sphincter and rectal mucosa. Third and fourth degree tears should be repaired by experienced providers. Begin by placing an anchor suture at the apex of the vaginal epithelial laceration. Use 2-0 or 3-0 absorbable suture material. Then continue to repair the vaginal epithelium using a running locked suture and avoid taking wide bites, which would tend to contract the wound and narrow the vagina. Also, avoid placing sutures too deep. If sutures reach the rectal epithelium, infection and rectovaginal fistulas can result. At the junction of the vagina and perineum, insert a transition suture. Now at the perineal level, use a running suture to close the muscular layer. The outer bite of these sutures should be at the junction of the skin and muscular layer. This closure decreases tension on the perineal skin. After closing the muscular layer, insert a transition suture and then close the perineal skin using a running subcuticular suture and moving in a cephalad direction. Complete the closure at the level of the vaginal introitus, then insert and tie a final suture inside the vagina. Do a digital rectal exam to make sure that sutures do not involve the rectum.